Hello, it's Nurse Amy back on your screen. Thank you for tuning in to another episode in our What is IV Therapy series. And today I'm going to be treating another treatment that is also popular. And one of the reasons why people get IV therapy, it's for immunity. So we do have a lot of that. We have immunity boosters, IVs, and we also have them in IMs. So again, just I'm going to talk about them, and if I'm not answering specific questions, please feel free to comment or DM me. So just moving right along, again, we've got our fluid, which is normal saline or, lactated ringers. This keeps coming up because we've got to have a medium that actually goes into that we can push those ingredients through, right? So we've got our liquid, which is normal saline, and then we've got zinc. Zinc is great. I don't know if you guys remember this, but during COVID in 2020, oh my God, that's like 4 years ago. It's interesting how life, we survived COVID. Oh dear. Zinc was quite big. Zinc was one thing that a lot of people were taking either orally, orally. A lot of people orally, they were crushing it, they were swallowing it, or they were using it, mixing it with lemons and lime and some other kind of stuff. But zinc was a big one because zinc was found to actually help in targeting and improving the airway. So if we're talking immunity, essentially immunity comes when we are immunosuppressed. A lot of times our airway can be compromised. Our airway can be challenged. You have a lot of mucus, phlegm, and I remember again breathing. Those are the ubiquitous places that's attacked. So you had people being able to clear their airway because they were just chewing on zinc tablets. I remember that. I remember people talking about it. So zinc, blocks viral replication. Ding, ding, ding. That's the reason why. Zinc blocks that's virus replication. Is very crucial for normal development or functions of cells, mediating non-specific immunity such as neutrophils and natural killer cells. Okay, that's a lot of science speak. And I really don't want to be talking over your head. Essentially, what he's saying is very good for the immune system. It really, really helps to amplify the work of our antibodies, the work of our immune system. So when you take zinc, essentially it helps you fight colds, it helps you fight cough, chest cold, head cold, it helps you fight spasm and phlegm in the airway, in the lungs and stuff like that. So again, it's no surprise that it's part of the makeup of IVs that offer immune boosters. So you've got zinc, you've got vitamin C. I mean, come on. Even the old wives' tales tells us about vitamin C, where people are drinking tea, herbal tea, and then you put a drop of lime or lemon in it, that's vitamin C, or even orange. Again, all those are big antioxidants. Remember in my last video in the beauty, because it's also in beauty, because it essentially is so great in antioxidants because it fights free radicals. Free radicals are not your friend. They're nobody's friend because what they do is they just go around destroying things that are vital to the body. So what ascorbic acid or vitamin C does is to neutralize those free radicals. Okay, neutralize, like kill them, or just render them impotent, useless, ineffective. Okay, and then glutathione. Again, here we go. Glutathione is here again. It's a big antioxidant. It's like holy grail in skincare, it's holy grail in anti-aging, it's holy grail in immunity. Glutathione is big, okay? It's also very big. And then, of course, we've got the vitamin B complex. The good thing about the B complex is got this about 6 or so vitamin B family in it. Essentially, now they're very minute. We need them in very trace amounts, meaning minute amounts, not quite a lot. However, they're very essential. If you're lacking in any of these B vitamins, it affects your life. It really does. So that's why, and it's so easy to miss because people they're not big, but that's essentially why the IV therapy is getting even more popular, because more people can get it now directly to the bloodstream and into the cells where it's actually needed. They are big in making sure that, I'm talking about the B complex now. Those B vitamins, they work on nerve cells, they work on blood cells, they work on muscle cells, they work on the organs, the eyes, the lungs, the brain. They're so intricate they work on so many of those intricate things that we don't even think about. It's like, think about a car. And you're thinking, well, we need gas, we need oil, we need water, right? However, believe it or not, you can have all of those things, and maybe one of those very little filaments, little thing that's just like a little wire is missing, and you can have all of those other things. Just because of that little wire is missing, the car won't start, or it won't run, it just will not work. That's how vitamins are. They're called micronutrients. I think I mentioned them in one of my videos. They are micronutrients, but they're so powerful and essential for life. So you've got the B complex as part of your immune boosters ingredients, and then you have excuse me, B6. Another name for B6 actually is pyridoxine, and sometimes that's given to you in addition to, because it's part of the B complex, but it's also given to you as an addition. I can tell you right now, immune boosters are very popular, and I will say, especially since COVID, more and more people have come to realize that we work so hard, we work a lot, and we don't eat enough food, we don't eat the right food, and we don't eat enough of the right ingredients in our foods, right? So IV therapy is that thing that's now trying to deliver those things that we're deficient in, and is begin to write a lot of things that we were not even aware of. Something I'm going to start mentioning, and I think I mentioned in my other videos, but I'm just going to mention it here. As in other medications and other treatments, is not necessarily for the pregnant woman or someone who's nursing. That's why it has to be prescribed. Any vitamin treatment you're getting has to be prescribed, so you're given the go-ahead if you can get it or not. The one that I know, it's really good because it's targeted towards expectant man or woman, is the prenatal. Okay, so until I come your way again, we talked about the immune boosters therapy. It can be in an IV form. It can also be in the intramuscular. You can get a shot, like I am. But until I come your way again, be safe, be kind, and I'll see you in my next video.